Thanks, Matthew. I think you got the loudest clap for this morning thus far. That actually ends our welcome and introduction and the basics. And I'd like to introduce the chair of the next session, Margaret Ryan, who works as a nurse consultant at Prince of Wales Hospital. Hopefully you're here, Margaret. Okay. Well, I might actually do Margaret's job. So this next session is a patient enablement session. And here we actually have clinicians coming up to speak about how best you can actually identify certain symptoms and, in a word, self-manage, because there are many important ways that you can actually feel and function better that don't involve doctors and drugs and clinical trials, and they're very important. So first up I have Elyn Montgomery. Elyn, are you here? Fantastic! So Elyn is a highly specialised nurse who works very hard in the St Vincent's cardiac amyloidosis clinic, where they don't just see people with heart disease, but this is her actual nurse speciality, and she's very invested and very dedicated to her patients. So please come up.
Thanks, Fiona. Morning, everyone. Thanks for making it on a Saturday morning, so early as well. Let me just work this out. So Matthew just did an excellent job of going over the basics of amyloid, so I don't have to do that, but you can just see here in the slide, so I'm obviously focusing specifically on the heart, how those fibrils or those bits of protein deposit within the heart and cause that heart to thicken and stiffen. So this then causes heart failure, and heart failure in amyloidosis, it is a long-term condition, it's a chronic condition, and it's going to need lifelong management. So we already looked at some of the symptoms generally to do with amyloidosis, but specifically in heart failure, the most common symptoms that we see, and I'm sure many of you in the audience have probably experienced, fatigue, shortness of breath, particularly on exertion, and swelling in the legs. However, there's a broad range of symptoms, and it's important to keep in mind that people are going to present differently, so not everyone's going to experience all of these symptoms. So other symptoms can include things like increasing weight, which I'll talk at length about, chest pain, irregular heart rhythm, bloating, nausea, dizziness, and importantly, low mood. It can really affect mood as well. So I worked hard on this diagram the other night, but looking at self-management in heart failure, it's very, very important. And this is part of living well with heart failure. And there are really some key pillars of being able to do this well. So firstly, having a basic understanding of the disease, the treatment or management, and you certainly don't have to be an expert, but having that basic understanding of what's going on and why you're being asked to do the things you do as far as your treatment and management plan. Knowing how to monitor yourself is key to having a really good quality of life. Knowing when and where to seek help as well is crucial. So the other point, really important, taking your medication as prescribed and understanding why you're taking that medication, why it's been prescribed and how you're taking it. And then also following the treatment advice from your healthcare team. So they obviously prescribe you with medications, but there's a whole other component of non-pharmacological management of heart failure. And by doing all this, by nailing all of these 4 pillars, you're going to give yourself the best chance of really maintaining your health and optimising your quality of life and staying out of hospital. So before I jump into this, I will just say that my amazing colleagues are going to stand up after me and contradict everything that I'm going to say. And this is the complexity of amyloidosis, and I think that this point really highlights why it's so very important that a multidisciplinary team is involved in your care, and that you get the advice from all of the experts, because it's really difficult if you have multi-system involvement. But as far as managing your heart or your heart failure, fluid volume management is such an important part of managing your heart, and it's often poorly understood for various reasons, but I only have 10 minutes, so let's get on to how to manage your fluid. So essentially, the heart's a muscle. Its job is to pump the fluid around your body. So when you have those amyloid fibrils deposited in your heart and your heart's stiff and thick, it can't pump around the fluid as well as it usually should. So that fluid's got to go somewhere. So it will often manifest as shortness of breath, so it's sitting in your lungs, or fluid in your ankles, because your heart's just unable to pump it around your body. So, things that you should be doing every day. Daily weight. And when I talk about weight, I'm not talking about what you had for dinner or your fat weight. I'm talking about fluid weight. This is one of the best indicators, earlier indicators of telling us that your heart's not functioning so well and that we should intervene early. So the advice is, the recommendations from the Heart Foundation of Australia: get up every morning, do a wee, so you're not measuring the wee weight, before you eat anything. Either take your pyjamas off and do it nude, or be consistent in the clothes that you're actually wearing, and then record your weight as well. So there's no point doing it if you don't have a record of it. And a lot of patients like to graph it rather than write down the numbers, so they have a visual of what their weight's doing. And we do say that if your weight has either increased or decreased by 2 kilograms in 2 days, then you need to be contacting your GP or your heart failure nurse. So 2 kilos equals roughly about 2 litres of fluid. So this bottle up here is not advertising. So this is 2 litres, which equals about 2 kilos. So you can imagine if you've got this amount of fluid in parts of your body that it shouldn't be, it's going to obviously cause you lots of problems. If you've got 2 litres in your lungs, if you've got 2 litres in your ankles, you're going to be very uncomfortable. And we want to intervene early to get on top of that. So moving on to the next point, maintaining a fluid restriction. So generally people with heart failure shouldn't go above 2 litres of fluid a day, or whatever's recommended by your specialist. Those that are actually symptomatic, so do experience problems with swelling in the legs and so on, you should probably stick to about 1.5 litres, but definitely get the advice from your specialist. Now, it's important to remember that fluid restriction includes things like not only water, but tea, coffee, alcohol is a big one that people often don't think about, soups, ice creams, jellies, that kind of thing. And important to record your fluid intake. So no point thinking I'm on 2 litres a day if you don't actually know what you're intaking. The next thing that's really important is limiting your sodium to about 2 grams a day. So some pointers on how you can do this. Eating more vegetables, using herbs and spices is a big one to flavour the food rather than salt and pepper or salt. Cooking at home, takeaway and eating out can have such a high level of hidden salt. And you should be roughly aiming to, looking at food labels. So if you're learning to read food labels, this is something I'm terrible at. If you have a basic understanding and you're looking for foods that are around less than 120 milligrams per 100 grams is ideal. And if you're really struggling with food and getting into good eating habits, then a dietitian, ask either your GP or your heart failure service for a referral to a good dietitian. They can offer excellent advice. The next point is diuretics, so which help offload fluid. I'm talking for way too long. Taking these as prescribed, obviously taking all your medications as prescribed is super important, but also learning, if appropriate, to be able to titrate your own diuretics. And you can talk to your specialist or your heart failure nurse about this. Finally, in regards to fluid volume management, knowing when to contact your GP or heart failure nurse. So I've already spoken about increases in weight. If you've noticed an increase in your shortness of breath, either at rest or on exertion, If you've noticed increased fluid retention, so increased fluid in your ankles, if your pants are a little bit tight and you accumulate fluid around the abdomen, increasing cough, increasing fatigue and lethargy, if your heart feels like it's beating strangely, if you're experiencing palpitations, if you're feeling dizzy, faint, or just generally unwell, it's better to check in with your GP or heart failure nurse early and intervene early rather than leave it and end up in hospital. So just quickly, physical activity, super important. This includes things like, we need to be aiming for 30 minutes of moderate intensity exercise on most days. This is the recommendation. What you're doing should include things that are addressing strength, balance, endurance and flexibility. Really important that you're finding something that you enjoy. There's no point trying to drag yourself out the door every day for something that you're hating. So do try out different activities. I just wanted to flag as well while we're on it, cardiac rehab and heart failure services are an amazing resource. They are available all around the country. There's an online directory with contact details for those services. If you haven't visited your local heart failure service, they provide education, they provide exercise advice. I highly recommend speaking to your GP or your heart failure nurse about being referred to one of those services. Lifestyle modification, super important. Stopping smoking, hoping no one in this room is smoking, but please try and link in with Quitline if you need some support around that. Avoiding or limiting alcohol and caffeine, sometimes easier said than done, but do try and avoid it. Maintaining your healthy weight in line with the heart healthy diet. We've already spoken about physical activity. Managing stress is huge. So reaching out to those support services, friends, family, carers, the AAN, and seeking the advice of professionals if you need to as well. So mental health services, getting adequate rest and seeking support I've just spoken to. I'm running quickly out of time, so just wanted to flag the really, really important job of support systems. All of you guys here today do an amazing job for our patients, keeping them healthy and really supporting them. You can see the list of points there on the side of all of the benefits of really effective support systems. So I just wanted to flag a resource that's available on the St Vincent's Hospital Heart Health Cardiac Amyloidosis page. It's a resource that we offer to our patients, and it's a PDF that you can print out and you can stick on your fridge, and it just has those points as a reminder of things to do every day. I just want to thank all of you for attending today, acknowledge the following people, and thank you.